Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. I hope that you have been enjoying all our sessions with our top experts as much as we have enjoyed presenting them to you. In these days, when one is surrounded by an overload of medical information, some medical terms are often thrown about even in all our conversations all the time, and one such is cholesterol. We often hear references to people talking about their levels of cholesterol, how to reduce it, and of course, the good and bad forms of cholesterol. Cholesterol is nothing but a waxy substance which is found in your blood. Your body actually needs cholesterol to build healthy cells, but high levels of cholesterol can increase your risk of heart disease. And you can develop many complications, such as fatty deposits in your blood vessels. But high cholesterol can be inherited, but it's also very often the result of unhealthy lifestyle choices, which makes it quite preventable and treatable. So, today we are going to discuss cholesterol in great detail so that you can learn all about keeping your levels optimal and avoiding the risk of heart disease. To discuss this topic, I'm very happy to welcome Dr. Vivek Kumar, who is a senior cardiologist and a specialist in interventional cardiology, cardiac electrophysiology, and structural heart intervention. Dr. Vivek Kumar has special interest and expertise in advanced structural heart interventions, arrhythmia mapping, and ablations. With a DM in cardiology and MD in general medicine, he also has a number of impressive certifications. He's certified in international preceptorship in structural heart intervention, TAVR and Mitra Clip 2018 from Cleveland Clinic, US. He underwent the Evolute R certification program in heart training from Medtronics. Also, the complex coronary observership from in 2019 from the Sagamihara Kyoto Hospital, Kanagawa and Fujisawa Tokusyukai Hospital, Kanagawa and Pranex, Japan. He has been an attending consultant in several prestigious hospitals and has been part of the Delhi Heart Lung Institute from 2012-13. He has actually discovered rare congenital venous anomaly in the heart and named it the coronary venocardinal vein. Welcome, Dr. Vivek Kumar, to this discussion. Thank you so much for joining us. So let's begin by going to the basics and asking you, what is cholesterol?
So, Dr. Shinidhi, you have already introduced cholesterol, and actually, cholesterol is something which is very important, integral to our body structure. So, cholesterol can be taken into the category of lipids, which forms about 70% of our cellular structures, tissues. Even our plasma has a various components of lipids circulating. So, cholesterol, as you said, is a waxy material. It is in a group of sterols. It is required for various important structural elements of our cell wall, tissues, hormones, a lot of fat soluble vitamins like vitamin A, D, E, all are formed from cholesterol. And the thing is that liver is the site of production of cholesterol. So our body does produce cholesterol, and they are distributed all through the body through the blood vessels. What creates the problem is if this cholesterol in circulation is more than what we are required.
So, why should one be concerned about cholesterol? Because most of the time people talk not about the actual functions of cholesterol, but then they are worried about their cholesterol level. So, what is the concern about cholesterol?
Dr. Srinidhi, over the years that we understood coronary artery disease, and we gradually discovered the risk factors that make us prone to develop coronary artery disease and peripheral vascular, that we combine called cerebrovascular diseases that can involve the brain circulation, the kidneys, the peripheral vessels, and definitely the heart, which we are most concerned about. So it was realized that the circulating cholesterols, which are there in the blood vessels flowing, they kind of get accumulated at various places in the essential organs in the blood vessels, including the heart, brain, and the peripheral vasculature. And this is what created our understanding of cholesterol's role in coronary artery disease, that it leads to a process we call atherosclerosis, which starts at a very early age and it gradually progresses over the years. And unfortunately, in Indian subcontinent, it manifests at very early ages, maybe 30, 40 years. That's why we are seeing a lot of heart attacks and issues related to cardiac diseases coming into news to alarm us. But in the Western societies, it usually manifests above 60 years. So this is the dilemma that we are facing here.
So we also hear about good and bad cholesterol. So now everybody reads about it and talks about it as well. So what is good and what is bad cholesterol?
Okay, so cholesterol being a type of fat, a lipid, it cannot be in the blood in its own form because it is not soluble in the water that is the predominant component in our blood. So it needs a binder, which is a apolipoprotein. So these apolipoproteins, they bind to cholesterol and they form different components of cholesterol. So in that, as we know, if you ever get a lipid profile done, you will realize that there's a mentioning of in the report of total cholesterol, and then you will find that there is a LDL cholesterol, the HDL cholesterol, and the VLDL cholesterol. So these are different components of the cholesterol lipid profile that we see. So the thing is that uh, LDL cholesterol and VLDL cholesterol are considered to be the bad cholesterol because they carry components which lead to a deposition of cholesterol in the peripheral vasculature. So if somebody is having high levels of LDL cholesterol and VLDL cholesterol, we call it bad cholesterol, and they need to be below a certain limits. The HDL cholesterol, it is like a scavenger. What it does is that it takes away the deposited cholesterol in the various vasculature, and they kind of chelate it from there and bring it to liver to be utilized in a more positive way. So if somebody is having high component of HDL cholesterol, which we call good cholesterol, it's good. And the bad cholesterol, we can say, is LDL cholesterol as well as the VLDL cholesterol.
So what are the normal levels of, so when you measure the cholesterol, what is the normal range that one should be aiming for?
Dr. Srinidhi, it's a very interesting question. And to be very honest, there is a no clear answer to it because over the years, as guidelines after guidelines came, we have been shifting our goals that what should be the ideal cholesterol level for a person. So I think this level is relative. So if somebody is having pre-existing heart disease in form of previous MI or established coronary artery disease or a CVA, cerebrovascular disease, peripheral vascular disease, for them the level of cholesterol is different. For people who have risk factors of having heart problems, like for example having diabetes or hypertension, is a smoker, for them you can say that it's different, and for a normal person it's different. So for a general population, we can say that lower is better. So if somebody is having a LDL cholesterol less than 100, that is an ideal scenario. But for people who already have a heart disease, now there's uniform consensus that the LDL cholesterol should be less than 50. Regarding the HDL cholesterol, which is the good cholesterol, it should be more than 40 in most of the people. And for another component of lipid profile, we measure it the triglycerides. So it's not the cholesterol, it's a part of another part of lipid profile that is predominantly circulating in form of VLDL. So we don't go for the value of VLDL cholesterol, we go for the value of triglycerides. So ideally, the triglycerides level should be less than 150, and anything above 250 is really high, and they need to be tackled appropriately.
So this brings us to the question of, like, how do you lower your risk? I mean, like if there is a risk for heart disease because of high cholesterol, how does one go about now addressing this problem? So, what can really one do to lower their cholesterol levels?
So, before going to your question, I would like to just briefly educate the listeners about the cholesterol circuit that happens, or what you can say, the cycle that goes on. So, there is an intrinsic cholesterol pathway and an intrinsic pathway. So, whatever we eat, the fat content in our food, which is in most cases is more than 30%. It's absorbed in the intestine and it is transformed into a form of a lipoprotein component. We call it chylomicrons. So whatever we eat, it's bundled into chylomicrons. It contains the triglycerides, the cholesterol, and it circulates in the body. And it's a fuel that is used by our muscle. Uh, Whatever expenditure it happens, it's the muscular activity is through these fuel that is delivered to the muscle, and whatever rest it is deposited into the adipose tissue that we call the fat cells. So insulin has a very important role here for utilization of these chylomicrons and the fatty triglycerides that we ingest. So if somebody is having insulin resistance, which we call, which is the common phenomenon in diabetic patients, what happens that they are not able to utilize this fat that we ingest, and it gets into the liver, and from here the bad metabolism starts, because what happens that you have more fatty components reaching to the liver becomes fatty, and liver then produces more of the LDL cholesterol and the VLDL cholesterol, and it circulates in the body throughout, and you have deposition of these cholesterol into peripheral vasculature. So this is how the cholesterol cycle goes on. So if you see the, I must impress upon that the muscles are the main organ that use up these fatty acids. So if you ask me what's the best way to reduce cholesterol, it's doing regular workouts, exercise, walking, because this is how you're going to utilize the fatty components in the diet that you're taking. And it is the most important remedy for reducing the cholesterol naturally. Apart from that, you have to concentrate on the diet quality that somebody is taking. It should be rich in fruits, vegetables, because they kind of dilute the concentration of fat in the food that we take, and it retards the absorption. So some way the over fat that we may be taking in our diet may not be absorbed. So that's good for us because it reduces the calorie intake that we take, and this helps. And there are certain foods like, for example, whole wheat grain, nuts. They are kind of, we have some evidence that they are good to reduce cholesterol.
Are there also medications that help in reducing, and at what point are they prescribed?
So we have an array of medicines in form of tablets and injectables also. The most common medicine that is advised by a physician or cardiologist to improve cholesterol profile or lipid profile is what we call commonly statins. They are basically HMG coenzyme reductase inhibitors. So basically they act on the intrinsic pathway of cholesterol synthesis. So it basically inhibits the production, biosynthesis of cholesterol. So statins are the most common drugs. A lot of people may be aware of that, the atorvastatin, the rosuvastatin, and things like that. Some people become a rare minor majority of people are not able to tolerate statins, and for them we have options of other drugs like, for example, ezetimibe, and very recently we have a new drug, the bempedoic acid, which we can prescribe in such patients who are not tolerating statins. And there are other forms of lipid lowering agents, like, for example, we have PCSK9 inhibitors. They are basically injectables, that can be given on a fortnightly or monthly or maybe 6 monthly injections, and they are quite effective in reducing the cholesterol level. And the best part is that not only they reduce the level of cholesterol, the bad cholesterol actually, but they have been shown to improve long-term outcomes, and they actually prevent heart attacks and heart diseases.
What is the kind of, we were talking about the diet that should be taken to make sure that the cholesterol levels are not going up. But these days, one often buys a lot of products off the shelves, like, ready made. And then sometimes we often find that it is written that it is low in cholesterol. So does it really mean that, one can eat those things? Or when they say low in cholesterol or low in fat, are these considered to be suitable for consumption, or is it better to always like eat homemade or fresh food? Not
So,
always possible for everyone.
okay, I got it. So, definitely, I will recommend that the processed food, the canned products, they may be mentioning that they have low cholesterol, but you should be aware that what's the component of trans fat or saturated fat in that. So, actually, if you say that cholesterol comes from animal sources, so animals are the only organisms that can synthesize cholesterol. So any animal product, they have some component of cholesterol. So even if they have a low cholesterol, and it's the processed food, apart from not having cholesterol, they may be having saturated fatty acids, trans-saturated fatty acids. So I think cholesterol is a generic term that we use for bad lipids. So it's not just cholesterol. It's important that the other components of lipids, the in form of saturated fats, and they are also harmful and detrimental for our cardiovascular outcome. So whenever possible, I think these processed foods should be avoided, or at least to be limited to the least what you can have, and encourage natural sources of food, home cooked food. I mean, fresh meat. If somebody wants to have it, they should really be encouraged actually instead of these processed things.
So what are the foods that one has to absolutely avoid if your cholesterol levels are going up?
So, coming to this question, our body, in fact, the liver is the production house of our body. So whatever we take, it goes to the liver, and based on our utilization, it is transformed or changes into our requirements, and whatever it is not needed, it is stored in the liver or the adipose tissue, and so this is how we gain weight. So definitely, the first component of diet is the total calorie intake. So we should not be in this misconception that if we are not taking fatty food, we will not have bad livers. The thing is that the carbohydrate, which is the predominant component of most of the Indian diets, they can be easily transformed into fatty acids in the liver. So, and they will be stored in the liver. That's why it's very common in India to have fatty liver on ultrasound, routine ultrasound investigation. It's very common. So it's very important that our diet should be wholesome. It should be balanced, and the carbohydrate component should not be more than 50% of our diet. The diet should be having good amount of protein. So we say that 1 gram per kg body weight should be the protein requirement of each individual. So if somebody is 80 kgs, he needs 80 gram of protein. So we must be very particular about our protein intake, that are we taking sufficient protein or not? Are we taking sufficient vegetables and fruits or not in our diet? And then comes the fat component. So if our total calorie intake is commensurate to the need of our body, I mean, whatever our body is needed, I mean, this is what we should focus on. And definitely there are certain food items, as I said, that foods which are rich in trans-saturated fatty acids, cholesterol are definitely so the fried food, the baked food, processed food, all these are having a high calorie as well as high component of trans-saturated fatty acids and cholesterol, and that should be avoided. One question that a lot of people ask, so if you see, egg is a very is quite high in cholesterol intake. So a lot of people ask me that, and a lot of maybe a lot of physicians may say that should we take egg or not? So
Yeah.
I think this is something is like a dilemma, or something which is very confusing, because there are a lot of trials that have been done on feeding eggs. Incidentally, egg in addition to having cholesterol is very rich in fat soluble vitamins. It is rich in protein. So somehow egg, I mean, daily you can have one egg every day, and we have studies that show that it doesn't increase cholesterol. So you should comfortably take one egg a day. It's not going to harm you, in fact, because it's a good source of protein and vitamins. So somewhat it neutralizes the cholesterol that may be having in egg. So I think we can have these foods for our good lipid profile.
So, at what age should one begin to start undergoing the checks to have to measure the blood lipids and other important parameters?
Dr. Srinidhi, I would like to share a very, unfortunate experience that I had during my, cardiology career, I'll say. The youngest patient that I did a primary PCI was a 24-year-old male, just 24 years. And unfortunately, he died after that attack. He had a massive heart attack at the age of 24. We could salvage his heart, but unfortunately, he had a brain stroke after 24 hours of the procedure, because the heart function became very low after the heart attack, and he died. So, Indian genes are susceptible to having heart problems. Our diet is something which can be some way related to that, in addition to the genetics that we have. So for Indians, I will recommend that after age of 20 years, one should at least visit once to a preventive health checkup. They should check their blood pressure, lipid profile, blood sugar. If it's fine, they can do it every 5 years. But after 40 years, I will strongly recommend that one should go for a yearly checkups for these risk factors.
And also, how often should it be checked? Like, if you, is it all right to just do it once a year, or does it need to be checked more often?
So, as I said, that after 40 years, I think it should be yearly for male and female both. We often see in our clinics that the male patients are more commonly getting the preventive checkups than the female counterpart. So, one thing that I would like to highlight, that though we have high incidence of heart problems in male, but in females who have risk factors for heart problems, they are in fact more vulnerable to develop complications because of cardiac issues. So I think for male and female after 40 years, I think it should be yearly checkups. And for younger patients, it can be either 5 yearly or 2 yearly. So, but at least it should be checked. I mean, one should not be in this misconception that being young makes you not vulnerable to having a heart problem. So in India, heart problem is a real problem, and we should all be very careful about it.
Finally, Doc, I just wanted to ask you, what is the link between, triglycerides, which is also another term that is commonly used by people, so between triglycerides and cholesterol, and also between diabetes and cholesterol?
So this is interesting, and just I would like to explain that. So lipids are important component of our body. Lipids can be in form of triglycerides, fatty acids, cholesterols, fat-soluble vitamins. All these are encompassed into one category we call lipids. So for us, triglycerides is a normal fuel for our body. So the food that we take in, the fatty acids that is there in the food, they are transformed into triglyceride and packaged into chylomicrons and they circulate in the body. What happens that if we take a lot of triglycerides, fatty food in our body, what happens that the cholesterol, the LDL cholesterol particularly, they are actually the carrier of just cholesterol. So if somebody is having high triglyceride levels, they make these LDL cholesterols more dense. And we call it very bad cholesterol because small dense LDL cholesterol, which is having high component of triglycerides, are the most prone, most important risk factor of having deposition of cholesterol peripherally. So if somebody is having a high triglycerides and a high cholesterol, this is a person who is having more chances of having peripheral blockages in the vessels and having heart attacks. So this is the linkage that we have between the triglycerides and the cholesterol. Coming to diabetes. So this small dense LDL cholesterol, which is the most serious component of bad cholesterol, I'll say, is more found in diabetic patients. Because in diabetic patients, we have insulin resistance. And as I said previously in the start, that insulin is very important for utilization of fat. So in diabetic patients, there is a saying that water everywhere, not a drop to drink. This is what happens in diabetic patients. Because of insulin resistance, we have glucose all over the body, we have fatty acids all over the body, but the body cells are not able to utilize it. So what happens, all these glucose and fatty acids, they accumulate in the liver and they are packaged into this small, dense LDL cholesterol. And this leads to more blockages. And this is not a surprise that triple vessel disease. So in the heart, there are three vessels. And having blockage in all these three vessels are very common in diabetic patients because of this metabolic element that is there in diabetic patients. And this is the linkage between the triglyceride and the cholesterol.
So thank you, Doctor, for this very wonderful, detailed and elaborate discussion. So viewers, I do hope that you found this session informative. So please take this message that it's important to do your best to make choices that keep your cholesterol levels in a healthy range. It is very important to make those changes in your lifestyle that can positively impact your cholesterol. Remember to also do your blood tests to check for your cholesterol levels, to do your annual health checkup, talk to your healthcare professional about your lab tests, and also learn about additional strategies to help to manage your cholesterol. Please subscribe to our social media channels, to our YouTube channel, to also get all the latest information on other trending healthcare topics. If you have more queries, you can reach out to us at any time. Do take care and be safe. Thank you and namaste.